Hello, my name's Becca, and today I'm going to be talking to you about pelvic floor exercises. You may hear midwives and doctors refer to something called the pelvic floor, particularly during and after the birth. The pelvic floor comprises of all the muscles running from your pubic bone at the front of your pelvis right to the coccyx, which is the small bone at the base of your spine. These muscles, or the pelvic floor, hold all of your pelvic organs in place, such as your womb, your bladder, and your bowel. Your pelvic floor is particularly important as it enables you to pass urine and to pass a bowel movement or poo. It can also prevent you from doing these things at the wrong moment. The later stages of pregnancy and the birth of your baby can put a lot of strain on your pelvic floor muscles, and this can cause problems like urinary incontinence, wetting yourself, when you cough, sneeze, or laugh. So it's really important to make sure that your pelvic floor is in good shape. Can you imagine expecting somebody to run a marathon when they've never even run to the end of the street before? They'd need some regular and probably quite intense training first, or they'd risk injuring themselves. It's the same principle for your pelvic floor, but there is hope. Regularly doing pelvic floor exercises throughout your pregnancy and into the postnatal period is just like the training for a marathon. It gets your muscles in good shape and ready for the birth, and it helps your body to return to normal quickly afterwards. Thankfully, unlike the training for a marathon, pelvic floor exercises are quick and easy to do. You can do them whilst brushing your teeth, whilst eating dinner, working at a desk, or watching TV, whatever suits you best. To work out where these muscles are, find somewhere comfortable, either standing or sitting, and imagine the feeling of stopping yourself from passing urine when you really need the toilet, or try stopping yourself from passing wind, or clenching the walls of your vagina together. You will feel which muscles are moving as you do this, and these are the same muscles that we need to target and practice clenching and unclenching. When you get really good at these exercises, you can actually isolate which areas you are clenching and do them in turn. Try to avoid tightening your glutes, the big muscles in your bottom, or your abdominal muscles. Just focus on the pelvic floor muscles. Don't do this while you're urinating though, because it can damage your bladder if you do. Once you're comfortable and you've worked out which muscles we're talking about, try clenching and releasing these muscles in quick succession. For example, clench, release, clench, release, clench, release, and so on. Start off doing this for about 10 times, but as your muscles get stronger, try to increase this to 50 times, which should take you around a minute. This will strengthen the surface muscles. Give yourself a 30-second break or so, and then we're going to try to strengthen the deeper muscles of the pelvic floor. Using those same muscles, clench, but hold that clench for as long as you can. Aim to hold it for 10 seconds, but work up to this if you need to. And that's it. It won't even take you 2 minutes. And if you're doing it correctly, nobody will even notice you preparing for that marathon. So just try to do these 3 times a day throughout your pregnancy, and ideally for the rest of your life. It could prevent problems later on in life with your bladder control and incontinence. Take a look on our website, mybirthmychoice.co.uk, for further information.